This is the In Focus podcast from The Hindu.
Hello and welcome to the In Focus podcast. This is Nitika Francis on The Hindu's Data Deep. Today, we're focusing on the lives of people with disabilities in India. India has several policies designed to support people with disabilities. Yet, data shows that many are unable to still access these benefits. A major reason is the lack of a unique disability ID card, which has become essential for availing government schemes and entitlements. The unique disability ID card is an important document for people with disabilities. It serves as proof of their disability status and helps them access a range of government benefits and schemes. At the same time, it enables the government to maintain an accurate count of persons with disabilities so that resources and support can be better planned and allocated. Yet, the data shows a stark gap. On average, only about 39% of people with disabilities in India actually have a unique disability ID card. Joining us to discuss this issue is Mr. Shashank Pandey, a lawyer and founder of the Politics and Disability Forum, who works on political representation for persons with disabilities and is a former research fellow at the Vidhi Center of Legal Policy and worked as a legislative assistant to a member of parliament with a Lok Sabha MP, wherein he worked on disability related matters. Thank you so much for joining us, Shashank.
Thank you, Nitika. Thank you to your team and to you for having me.
So, I wanted to start with a simple question, which is what are the hindrances that cause this lack of unique disability ID cards?
Yeah, so there are more of both on the administrative side and on the practical side of it in terms of implementation of the program itself. Since its inception in 2016, so UDID was designed as a platform which is primarily controlled by the union government, which is the Department of Empowerment of Persons with Disabilities. But the disability subject in itself is more of a state subject, which comes under state jurisdiction. And hence, what was there before UDID was that state authorities used to issue their respective disability certificate. Now, since the inauguration of the UDID, they have been trying to have this one set of ID for every person with disabilities. Now, the foremost barrier that UDID was in terms of rolling out and telling each state and the respective authorities, because certification happens at the lowest level, which is district or taluka or block level. So the UDID took time. It has different inception time in each state. For instance, in Karnataka, it started back in 2019. And in other states, it started in 2018. So every state has different timeline and hence the different coverage that we see. So that's one thing that the department has struggled with in terms of now they have almost, now we are in 9th year. Now they have sort of rolled out. Now the other problem exists is the digital literacy aspect. Person with disabilities data shows that one of the most backward in terms of socioeconomic. So not everyone is that well versed in terms of navigating that digital interface. And UDID is entirely digital. There is very little aspect that from starting the first application to getting your ID actually downloaded, it's all online that we have. And the person with disabilities themselves, apart from digital literacy, also suffer from digital inaccessibility. So that's another component. And the third component that has plagued the system is actually the assessment process. So UDID has it been implemented in a very staggered or in a very not uniform way. As in, so for instance, if you have a certificate when the UDID was rolled out. So for instance, I'll take my example. I had a certificate when UDID was rolled out in 2016. So what I can do back then was that go on the portal, submit my disability certificate, and the UDID will automatically be generated. And obviously, if you have a temporary certificate, that UDID will expire after a while, and then you'll have to go on the portal again and apply for a new one. So this assessment process, whether you will be getting a disability certificate or it's just a UDID, there has a transition happening. So in 2021, they decided that only UDID will be issued from January 2021 from the portal and not the certificate. Although this information sort of took time to percolate down to the lowest level where the certificate authorities were responsible. So this again, this change of policy, that this transition from certificate to PUDID, especially in the context of temporary and permanent. This differentiation creates a lot of confusion among people itself, whether you have to apply, you don't have to apply. So that's another sort of barrier, that it has been very cluttered as a system in terms of operationalization. And I think last aspect which has been plaguing the system is the medical assessment itself. That a lot of issues have happened. We can discuss the contemporary issues that have recently happened. What it has led is to that the UDID process or the medical assessment for issuing of UDID itself has become very stringent, and hence the numbers have dropped more in the recent years, especially the last year that there was. So yeah, I mean broadly these are sort of barriers that are existing still.
Speaking of the medical assessment, so from what I understand, people with disabilities can opt for reservations for employment in government jobs if they qualify for the 40% disabled category. Could you please explain what are the issues with this approach to it? Because as of the 76th National Sample Survey, only about 24% of people with disabilities are employed. So, this 40% disabled category, what is the issue with that? And how are people who fall below the category of 40% disabled, how are they compensated for?
So this 40% categorization was created solely for the purpose of reservation. That's unfortunately the anomaly that we have, that this tool, policy tool as you can call it, was devised so that reservation can be operationalized, and this threshold was opted for, that everyone at 40 or above 40 will be eligible for both education and employment reservation. It's also applicable for 5% education, 4% employment reservation, and this is only for public enterprises. So it is, the reservation applies only to government and government institutions, government employers, government education institutions. It's not applicable to private players. So that's one limitation, that it's not applicable to private players. And the government is one of the is not a very big employer. The biggest employer is the railway within the government. It's mostly the private sector which is the bigger source of employer in when we look at the macroeconomic perspective. So that's one thing. That's why the NSSO data shows what it shows, that almost 3/4 of people are not employed. So that's first thing. Private sector can't be compelled to provide reservation. Obviously, there has been a demand that there should be sort of some mandate, something that should be provided for. RPWD Act, as it stands now, doesn't provide anything of that sort. So what it can do is incentivize private players to hire them, and it has done so through tax benefits and other procedural benefit, licensing benefits. Those are things that government has been attempting, but it hasn't materialized, because the presumption at the private side is that there is far more greater burden in terms of hiring than what the benefit will be. So this messaging has not been there. Even the private players who have hired people have hired on a very lower level of staff. It's not at the maybe executive level or the leadership level or the management level. You will see very few people. So if the NSSO data ever sort of goes into that aspect, you will see there's 24%. Majority of them are at the lowest level of employment. So there is no recourse as such right now apart from reservation. What has happened for people below 40% is that they are not eligible legally for reservation. That's the law as it stands. However, there is a argument being made also before courts in certain cases that are being contested right now, that if there is a vacancy which cannot be fulfilled by any person above 40%, then that vacancy should be utilized for hiring person below 40. Now that itself creates a sort of challenge, in a way that there can be a person with just 5% who then might be eligible, and there might be a person. So how will you justify who to hire? So that's one limitation that we have when we have the below 40 base. So that's as it stands. I don't think we are going to get that below 40%. What government does is that if there is vacancy that's left unfulfilled, they just carry forward that vacancy to the next year and add it as a pending vacancy among the PWD quota.
Speaking of public versus private institutions, since you brought up the sort of systemic exclusion of people with disabilities, I also wanted to bring up how very few public institutes, educational institutes in India, provide the necessary aid for people with disabilities. So, as per UNICEF, only 10% of Indian schools have the required assistive devices like wheelchairs and hearing aids. I wanted to bring back the UDID cards. Is there any way in which children with disabilities benefit from registering for these cards? And are there any schemes that actually help children with disabilities?
Yeah, so I mean, so we have to look at this again differentiation between union schemes and state schemes. Obviously, there will be different state schemes, so it's very difficult to ascertain that or comment on that. What is there at the union level is that there is scheme called, so there are two schemes primarily that sort of answers this query. First is the assistive device distribution scheme, which is called ADIP, wherein the nodal agency, which is Alinco, the public enterprise that actually manufactures assistive devices, is responsible for distribution of those exercises, organizing camps. So in the you'll often see that these camps are being organized in the respective state and the respective constituencies by MPs or their respective political figures, and the people are being distributed wheelchair, etc. So children also qualify for this scheme, and this scheme has been one of the most successful schemes in terms of budget utilization. There is a different aspect related to it, that this is also a scheme wherein the outcome is instantly visible, that if you are distributing an assistive device, that's immediately visible, the output is visible, and hence by default or the nature of governance is such, especially from the political class, that they want something which can be sort of put forward in a media which is visible to people that have done this. So ADIP scheme is successful, and it has also been given to children, and it's also being implemented in special schools, especially in special schools where students with disabilities are studying, and the department has taken a proactive steps in terms of rolling out the scheme, especially at those places. So children are eligible. What has transpired from this children's education aspect is that a lot of these. So if we look at UDICE data, so we have obviously a conflicting data set as well. UNICEF will say something, NSSO will say something, and UDICE will say something. UDICE will say, as per I remember, their data is like roughly around 1 to 2% children with disabilities are actually enrolled in schools, which is abysmal figure, which is also very true because for assistive devices, see, the Alinco specializes in assistive devices in mostly visible form of disabilities, which is like, for instance, wheelchair, locomotor disability, for blindness, sticks, or for hearing disabled, hearing assistive devices. There is a huge set of children, especially, who have not been diagnosed. If you are not physically disabled, it's very difficult to diagnose a children at the early stage. And these invisible disabilities have not been diagnosed, and hence there is no assistance as such, because these things cannot be controlled or cannot be overcome by any tangible form of assistive device. It has to be very structural. For instance, autism, for instance, intellectual disability. These are sort of things. Now, if we take blood disorder, for instance, sickle cell anemia and thalassemia, the two disabilities actually recognized under RPWT, there is no assistance provided from under the ADIP scheme, because in both the sort of disabilities, you require actually blood transfusion. So, for instance, for thalassemia, still the people at even the metropolitan struggle to get proper quality of blood, because in that you require regular at transfusion at regular intervals, for instance 2 weeks, 3 weeks. So that's struggle, and there is no scheme. So by nature, when thalassemia hits you, the other associated disabilities that will come in because of the the weakening of your bones, the weakening of your digestive system. So there is no sort of support system at that level, and hence you'll see a far greater education level in mostly the urban area. So whatever the figure that you are seeing is actually substantiated by the urban areas. If you go at the rural area, the figure is very low in terms of children's education.
So, speaking of visibility and how the more visible a disability is, the more likely it is to get aid or assistive devices, etc. I wanted to understand the sociological aspect of it. So I was going through the census data and noticed that in the ratio of male children to female children with disabilities, which is referred to as a sex ratio, there has been a large drop in the number of girl children with disabilities when compared to male children between 2001 and 2011, which is the latest available census data. So I have read reports that have called this drop in the female percentage as abnormal. And I basically wanted to understand, how does gender affect how disability is viewed, how disability is counted, and how data surrounding.
Yeah, so I think so. Census exercise itself has to be looked from a context. So, for instance, if I can go before 2001, disability counting has been happening at two level, like household level, and then you do the population enumeration. Even when you do the population enumeration, it's mostly the person at the head of the household who answers the questions for everyone. So the disability counting started back in 1872 when the first census was done in 1881. Back then, it was just four disabilities that were being counted. And from 1881 to 1931, when it was finally stopped before independence, you'll see that in a lot of these documentation or the report that the then British government published, there was a uniformity across all the reports, which was like the patriarchy of the institution, the the patriarchy aspect of the family. So their observation was that unless and until we have a physical disability, for instance, back then the four disabilities which were counted was blindness, leprosy, intellectual disability, and deafness. Those were the four disabilities that were counted. So they said that unless you don't have a physical disability, which is very apparent to the enumerator who has visited your household, the chances are you won't be counted. And that was uniform across the population. But they went on to observe that given India's low literacy rate and especially the patriarchy attitude of the family, the chances of women counting is even more higher, of undercount of women is even higher. So that was their observation, and that has been a synonymous observation across their. Now, in 1931, we stopped counting. So 1931 was the last census that counted disability. After that, the only census that counted before 2001 was 1981. And the reason was that 1981 was also the year of International Year for Persons with Disabilities. So the government didn't want to look bad in terms of international imagery, and hence they incorporated. So it's ironical that they counted even lesser disability than what the Britishers has counted. They counted four. The Indian government counted three. So disability in movement, disability in seeing, and disability in hearing. And they said after in their report they observed that this figure is again an undercount. And so they again dropped that disability counting is very complex when it comes to census. That was their observation. And this was also an observation before in the pre-independence time. 2001 and 2011, as you mentioned, the data that we finally have. So in Indian history, 2001 and 2011 are the only data on disability, reliable data. In 2001, what happened was that the previous legislation that we had, which was 1995, that only mentioned seven kinds of disability. And the 2001 census was sort of inspired from there, and only five kind of disability were counted. And in 2011, eight kind of disabilities were counted. So obviously that figure changed. The most change that you will see is in terms of the change in intellectual aspect, the disability which are not visible. So, those disabilities were increased. And so 2011 was different in that context. So the observation that was made even, pre-independence, that the stereotype of female counting in terms of disability associated to female is very high. So the undercounting in 2011 was just a byproduct of that. We as sort of society have still not been able to cope up that disability is normal. And it's obviously not normal for a woman who has to get married. So that the households were very reluctant to tell the society, even the enumerators, that their daughter is disabled, for instance, right? Because who will marry her if the locality comes to know that she's a person with intellectual disability or invisible disability. So that's why you see, the huge abnormality. I won't be surprised if the 2027 census also has this sort of anomaly in terms of the gender-based data. So yeah, I mean that's sort of fundamental reason why there is this anomaly.
You had mentioned the census and how has been this changing number of disabilities that are recognized in it. And as of 2011, there were eight types of disabilities. And I looked through the UDID data and the Rights of Persons with Disabilities Act, and both of them say that there are 21 recorded types of disabilities. So there's clearly a gap in what was the last recorded number of disabilities and what is currently addressed as the number of disabilities. I wanted to understand how this affects the drafting of policies and distribution of resources as of now.
Yeah, so I'll come to the latter part first, which is the distribution of resources. In distribution of resources, we understand the financial allocation, especially the budget allocation. So if we look at Union Departments of Empowerment of Persons with Disabilities, the nodal agency responsible for budgetary allocation, their annual budget in the last few years has been hovering around 1,200 crores. And you will see that historically it has always been underutilized. The underutilization may range from 100 crore, 200 crore, or maybe can extend up to 400 crore, which was there in back in just after COVID. That underutilization was to an extent of maybe 40 to 50%. That was the degree of underutilization. And what has transpired is that, so first thing, how that budget, this 1,200 crore was decided. This figure was decided by the expenditure fund. What we have, expenditure finance committee under the Ministry of Finance, which obviously suggests tentative bracket for each department and for each schemes. And this suggestion is based on the Finance Commission recommendations, which was the last Finance Commission 15th. And 15th Finance Commission took cognizance of this 2011 census data because that's the only official data for persons with disabilities. And they saw that there are only 2.68 crore people out of 120 odd crore people, which is very small population. So why does a department which handles with such a small population has to take such a large budget? That was sort of a reasoning or rationale for expenditure finance committee for allocating the budget to department and to different schemes. And what happened was the department was left with a very small amount of budget. And when we split that 1,200 crore across schemes and for each scheme across the states, then each state, the ratio of amount that each state gets is very, very minuscule. And hence, what we have in this, the structure is that states are not willing to do that extra administrative work to get that small amount of money, maybe like 15 lakhs, 20, because for them it's nothing. It doesn't make a difference. Why should they go in the bureaucratic process of submitting documents or submitting proposal for utilization of document? And hence they don't submit a proposal to the union department, and union department then doesn't get a chance to release that fund because they can only release the fund once they get a proposal from the state. So this is sort of a structural cycle when it comes to financial allocation that has what 2011 started is what people with disability are really struggling with, that undercount for last 15 years now. Now, how the policies are formulated? Policies are always formulated still based on the census data because that's the only comprehensive exercise which is done at each individual level. Everyone is counted. It's not a sample-based study, unlike NSSO or NFHS or other studies. Every individual is counted, and hence that's the most reliable, presumed reliable source of data. Now, any policy, for instance, let's say allocation for scholarship scheme, or maybe a policy for having in even in the umbrella policies that you have. For instance, if you are making a policy on rural household allowance, like free allowance, free distribution, etc. If you don't see person with disabilities having substantial population, you won't incorporate a special provision for them, which is done for children and women, for example, or old age people. That has by instance become a default exercise that there will be special provisions related to women, children, old age, maybe transgender people. Person with disabilities have struggled with. It's only starting from national education policy and now, Pradhan Mantri Awas Yojana, that they have made amendments to it and said that special provision will be there for person with disabilities or household with disabilities. So that's how the umbrella policy design changes and the need for policy is felt. So, for instance, this the pension scheme for person with disability, which is mostly by state government. You'll see in a lot of states, the pension amount is minuscule. It's around 1,000 rupees per month. It was even lower, around 500 rupees before. But now few states have increased that over the years, and especially in the last 5 years, we are seeing increase in the amount. And that has only happened because people with disabilities have started arguing that 2011 undercounted us. There is more than what the data shows. And hence, there is a need that you make more specific policies for person with disabilities. And that's how it changes. Just one last component, it's also percolates down to the political power of person with disabilities. That if the census data shows that there is only 2.68 crore overall population, that itself is a very small political constituent to be addressed. And unless you as a identity group are not strong enough to showcase that you hold strong political power to make a difference in constituencies, political power won't take you seriously. That's how the data sort of influences that aspect.
I feel like what you're saying is exactly reflected in what I've seen in reports, which is basically that the National Family Health Survey, which in previous editions used to collect sample data on people with disabilities, will not be doing so in the upcoming sixth edition. I think I was going to bring that up and ask you why, but I think this kind of perfectly explains why this sort of exclusion is still happening. And I also wanted to come to the crux of the issue, which is again the um, unique disability ID cards or the UDIDs as well. According to the website data from the UDID website, as of now, currently, for every card that has been issued, 3 cards are currently pending. As in, if a person has applied for it, they have not received it. I also saw that among the pending cards, 60% of the cards that are currently pending have been pending for more than 6 months. So, is there a legal recourse that people can use if they have applied for their card and are still waiting for its issuance? Because obviously this means a delay in them receiving their benefits and then just living their lives.
Yeah, I mean, so UDID, so this 6 month delay that you see. So last year, what the government did was that they amended rights of person with disability rules, and they before that UDID was not statutorily specifically mentioned under the rules. Last year was the first time that the scheme was brought under the law as UDID, and that was only done after the very infamous case of former IS trainee, the Pooja Ketkar case, wherein she misused her disability data or disability certificate to get the benefits of reservation. So the department thought that they have to make the process more stringent because it's being misused, which was a very flawed understanding of the entire issue. But what they did was that they mentioned that UDID has to be issued, and the timeline that they mentioned within the law and within the rules that it says is 3 months. Now, what was there before that was there was a timeline of 1 month that certification has to be issued, which also applies to UDID. So, by presumption, the presumption was that which has to be issued within 1 month. And the government rationale was that that timeline was very unrealistic. Even I think that timeline, who have gone through the process personally, I know that entire timeline is very unrealistic. So they said we have provided 3 month timeline that it has to be issued within 3 months. Now what the government didn't mention was, which was an omission, from which date this 3 month timeline will start. So the earlier law mentioned that the 1 month timeline will start from the date of the application. So the day I submitted my application, the UDID portal, the 1 month timeline will start. The revised rules as it stands today doesn't mention when this 3 month timeline is going to start. The presumption is that it should start from the application date, but whether it's so, we don't know. It can only be ascertained with the court passes an order. So that's one thing. Now the pendency issue that you see, for instance, let's say 2011 data, which says that 2.68 crore people are persons with disabilities. As per government's own admission, as on August, as we speak, only roughly around 1.2 crore people have been issued UDID. So even by government's own data of 2011 census, which is itself underestimate, only roughly around 40-45% population has been issued. Not even one half of population has been issued UDID. Now their argument is that a lot of certification rules have been changed. Since then disability number has increased. So those are, the procedural arguments that are being given. What happens actually on the ground is that when you apply for UDID, if you are not based in a metropolitan city, in a city where there is a hospital or medical college in your city which can assess your disability, or the board which sits on it has an expert who is also the expert on a disability that you've applied for, the chances of you getting a certificate is not even like you'll hardly get it in 6 months. It will stretch over a year. And this is what happens with people with invisible disabilities, especially from people who are coming from areas not in from urban areas, because then they have to apply to a UDID portal. They have to go to the assigned medical authority as per UDID to check with them. The board sits just once or twice a week. It's mostly once a week in most of the districts. So in a year, that's 52 opportunities that you have to go in front of a board. The board sits, they will most probably, because there are 3 or 4 people only on the board and there are 21 kinds of disability. So the chances are that you won't find your expert on the board. So the board will refer you to a medical college in your city. The medical institution may or may not have that facility to assess your disability. So for instance, in a lot of person with intellectual disabilities, it's the AIMS Delhi which has this facility. And even in AIMS Delhi, there are 2 departments. So there is, the department for intellectual disability below 18 is pediatrics, and for the above 18, it's a different department. So there are 2 departments for even intellectual disability. So you have to travel to AIMS. The chances are you won't be getting all the tests done in a single day. We'll have to make frequent travels. So for them to do that, especially when they don't know what the next test is going to happen, because AIMS also has a constraint of resources. So they have to come back, go again. This entire process, even if the facility is based in your city, takes roughly around 2 months, because you have to make 2 or 3 visits. Minimum is 3 visits, maximum is, there is no limit to maximum. So this 2 months, 2 or 3 months is obviously gone by then. The rare the disability or the hidden the disability, the more the delay. So that's what's happening, and that's why this process has been so slow in terms of rolling out, because the hospitals or the disability assessment experts are not there. It's only roughly around 250 medical institutions around pan nation that have been authorized to issue disability, and these rare disabilities, thalassemia, intellectual disability, etc., have to be assessed by expert in institutions like AIMS or maybe institutions from South India. So that's what's plaguing the UDID on the medical assessment process. Now, interestingly, the other aspect, which is why there is such a few, UDID process, is that the states are not taking proactive steps. Just a couple of days ago, I read that Kozhikode in Kerala started a scheme to cover every person with disabilities in their district to get them registered on UDID portal for issuance of UDID. So that has become now the first district to have 100% coverage of UDID registration. So the initiative was taken by state, because disability and medical assessment is a state subject. States are responsible for getting UDID, pushing people to get the UDID registered. The union government, can do so much, because ultimately it's the state which has the subject of both health and disability that they control. But the union government is responsible for disbursement of fund, and this is the data that the union government has revealed in the monsoon session, that the money that they have allocated for UDID is less than 1 crore. It's 88.6 lakhs to be exact. So 88.6 lakhs spread around 37 states and union territories. You can imagine the percentage of amount that each state and union territory is getting ultimately to roll out the UDID process itself. So they may say that they are trying proactively to roll out UDID, but the budgetary allocation and the other things are, so to speak, otherwise, and they are being pushed not just by people with disabilities, but as high as the Authority Controller and Auditor General, which in its report on RPWD implementation itself observed that the rollout of UDID has been very slow in India. So yeah, I mean, those are sort of the reality that we have exist with.
On the ground, how have you seen people deal with, the lack of the UDID card or unable to access assistive devices, etc.?
So in a lot of places where you do have knowledge, where you do have the privilege of getting to have digital access, etc., a lot of places you do try to reach out through social media, etc., or through civil societies that this is the problem that is struggling with. On other occasions, people reach out to courts. So, for instance, in recent judgments, many candidates reached out against the discriminatory guidelines of statutory authorities. So, for instance, Allahabad High Court recently passed an order wherein they said that once a person is given UDID, you can't call for reassessment. Similarly, another candidate who was denied admission at NEET, the Supreme Court said that once UDID is granted, you cannot ask candidates to go for reassessment. That's unfortunately the reality after the Pooja Khedkar incident, that they're trying to find people who have misused disability certification at the cost of people who are genuinely disabled because they are not getting the facilities. So, for instance, if you have to apply, you have applied for a job, government job or an admission, and the institute is asking you to submit UDID because the government has been pushing that this is a document which is be admissible as identity proof, and you don't, and they have given you a timeline of maybe 15 days or 1 month. There is no way that you are getting your UDID within 1 month. The process is not designed to give you a UDID for 1 month. So you are being denied rights. So the only recourse that you have is approach courts. Approach any stakeholder that you have. So people are struggling. The the push for UDID without the corresponding coverage of UDID, had it been above 75%, we could have understood why the push for UDID is there. But when your coverage is at 40-45%, the only push that you are giving is of exclusion because 55% are automatically excluded. Uh, right. And we have to also remember that the data that they have released of UDID, that the UDID that has been issued, there are chances that will be multiple UDID for a person. So, for instance, I've been issued UDID twice because my earlier UDID expired. That duration was just 5 years. So, I have to get a renewal of UDID. So, I don't know whether that UDID that I have got previously and now a new one, whether there is a double counting in the total figure or not. So, that's one thing, that how the data is being presented is also that on that level, it's also problematic that this 40-45% coverage might even be lower for actual person for disability, and it is because that 40-45% is based on 2011 data. You have no idea how many person with disabilities are there as of now, because 2027 census hasn't happened. Only then you will see what has happened. Till then, you ask how people are coping with. People are only optimistic and hopeful that the processes that are already very hard for them, being as a person with disability because of their inherent medical condition, the department, in the name of preserving the system, is making the system more exclusionary because the misuse is not done by people with genuine disability. Usually misuse happens with people who have resources, so that they are not changing their system per se. They are changing the entire metric. So, for instance, even if you get UDID, you have to get a reassessment if you're selected for example, UPSC exam. Everyone has to go through reassessment. Even now, states Public Service Commission are asking you to go through reassessment because they don't trust the UDID or the certificate that you have got. So the trust is not there. There is a trust deficient also on the certification process itself. Both. So that's another issue that people are now adapt, that the UDID may or may not be end to their benefic, the facilities to avail benefits.
Okay. So thank you so much that really informed me on various caveats and look out for when studying this data, and also just the sociological reality people who are unable to access the benefits that they have the right to. Thank you so much for your time.
Thank you, Nitika.
In Focus will be back soon with analysis of the biggest news issues. In the meantime, you can find our podcast on Spotify, Apple Podcasts, Stitcher, and other platforms. Just search for In Focus by The Hindu. We'll see you soon.